as a Chief Executive Officer here at Midshore Behavioral Health. I'm going to pause there and let our other Midshore team members that are on this afternoon introduce themselves. So I'll pivot and have Taylor Garrett introduce herself.
Good afternoon, everyone. I am Taylor Garrett, the hub manager here at Midshore Behavioral Health.
Thank you, Taylor. Bridget?
Sure. Hi, my name is Bridget Keeley. I'm a programs director here at Midshore Behavioral Health. Nice to see you all.
Thank you. And I think Trish is our...
Yeah, good afternoon, everybody. I'm Trish Todd. I'm the data and quality manager at Midshore Behavioral Health.
So we thank you all for being here. We would, of course... Oh, I'm sorry.
We got Rachel.
And Rachel's here. My goodness. There's so many people on the screen. I apologize, Rachel.
Hi, everybody. I'm Rachel Stoyanov. I'm the hub liaison here at Midshore Behavioral Health.
Thank you, Rachel. Sorry about that. And if you're new to the meeting and have yet to do so, if you could please put your name and affiliation in the chat, that would be greatly appreciated. So this afternoon, we are holding the space for what we like to call our pre-bid conference. We have the opportunity to extend the request for proposals for this next installment of the Coordinated Community Supports Partnership level of the consortium funding here in 4 of the 5 counties on the Midshore. So we are serving and receiving the applications for Dorchester, Kent, Queen Anne's, and Talbot counties for this installment of the grant. So we're just grateful to see so many familiar faces and some new faces here this afternoon on the screen. We really like to hold this space to really be here to answer any questions to the best of our ability that we can about the request for proposal and application process. And this will be posted on our website for anybody who was not able to participate this afternoon and tune in. But this will be the only space that will receive questions during the open procurement period. So that is something that we adhere to pretty conservatively. So if you get off the call today and think of a question that you wanted to ask, unfortunately, we won't be able to receive that outside of this time. If there's a question you haven't been able to get to before we close the meeting, we will honor those that get put into the chat. And full disclosure, if we don't have an answer today in this space, we will be collecting all the questions that are outstanding and putting our responses to those on our website. So hopefully we'll have the video from today and hopefully the answers to any questions available tomorrow or the latest early next week on our website. We are asking that potential service providers respond to Midshore Behavioral Health by the 17th of January. We are mindful that that is ahead of the February 4th deadline for the full application to go in. However, another part of our procurement process here at Midshore is we do convene what we call a program services committee. For this grant proposal, we will be convening members of our board of directors at Midshore Behavioral Health, as well as members of our interagency council, which is our governing structure for our hub pilot, to sit and review applications with us. So we need to allow ample time for that process and then to determine, including which service providers will be elevating into the full application that goes into the consortium on the 4th of February. So with that, I will pause and probably pivot over to Taylor to see if there's anything additional you would like to highlight about just kind of where we are in this process with this opportunity for the RFP, and then we'll open it up to you all to ask us any questions that you may have.
I think quite a bit of you were on the consortium call yesterday that they had. So a lot of information was answered then. it was highlighted, and I did highlight it in our RFP as well. I just want to reiterate that if you are a returning pilot, you don't have to complete a brand new section. You can update what you already have and submit that way, just since you are returning and you're a current spoke. Other than that, I don't have much off the top of my head. I think most of the conversation is going to come from questions from everyone today.
Taylor, do you want to update the budget piece to the group?
Oh, yes. We did ask for budget and budget narrative. We have worked with our finance department. We are going to send out to everyone that is interested the revised budget that the CHRC is providing, because I know that if you were on the call yesterday, the question was asked, the budget they sent out was for 3 years. This is a 1-year project, so they are editing their budget template to be 1 year instead of for 3 years and resending that. So once they provide us with that, I will send that out to everyone, and we'll use that budget template.
Taylor, can you just say that one more time?
So the consortium website and the consortium's RFP that was sent out last week has a budget template that was provided, but it is lists for year 1, 2, and 3. This is only a 1 year, like the grant period is for 1 year. So the consortium is taking off years 2 and 3 and resending it out to everyone. So you only have to fill in year 1, which will be July 1 to June 30th.
Thank you, Taylor. I've been trying to get that question answered for about 2 days.
Yep, I'm hoping that they'll send that out to everyone shortly, but as soon as they do, I'll send it out to everyone as well.
Okay, so if you want to just maybe by a raise of hands, if you have a question, comment, anything you'd like to offer for the good of the discussion during our time, we'll start off. Abby.
Hi, everyone, and thanks for holding this time, everybody from Midshore. Question about returning folks with our application that we're submitting. Do we have to add in all the appendices and things that were kind of scanned in from the prior year? Or are you just looking for our main narrative that was typed previously? Like we have our old superintendent letter and things that would have been applicable to our prior application. Do those all need to be included when I resubmit?
So letters
like
of
50 pages with all the appendix, they're long with all those scanned in and some aren't even applicable. So can I take them out and just submit what is going to apply for this year?
Yes, letters of support are not required for service providers that are applying through the hub. So you will not need to provide the letter of support. I'm looking for the list right now of all the appendices, like the transmittal letters and let's see, like the IRS forms and such, the W-9s, those are not required for this step.
Okay, and I'd have everybody's resumes in there and our licensures. Do you need all? No, okay.
No, as long as there is a portion in the actual application where you're in your narrative that says, I have 3 licensed, clinicians, that's what we're looking for. We don't need the resumes and such.
Cool. Thank you.
Mm-hmm. Catherine.
Thank you. I might raise my hand more than once, but my first couple of questions are, so we probably don't even want to do this, but I'm just checking. Last time in our grant, we had some sub-grantee, we partnered with another organization for a small part of our grant. Are we even permitted to do that this time? In other words, if do all services need to be provided by us and our independent contractors? Or are we permitted to partner with another organization? We were last time, and I'm assuming we may not be this time.
I think however you want to structure what your model looks like, I would submit it to represent sort of your vision for the program. So if you're replicating how it stands right now, we would want to see that. I don't think we're excluding that partnership relationship. So please, include how you would like to have your model fulfilled, and we'll be sure to take that into consideration.
And I
Okay.
believe, Taylor, if you can probably help me with this one, I believe it was in there that if they're working with a partner, they could submit like a some type of letter of support for their partner, correct? So that to me, I believe you could still do that model.
Okay,
I'm trying to put my
Yes.
fingers on it in that 100-page document.
okay. Yeah, I wasn't sure because really our partners last time, sort of the reason we had them was that they didn't want to undertake, it was too much for them to undertake applying for the grant themselves. And so
Right.
they sort of did it with us. But I didn't know if you'd want to make sure that everyone applies directly as opposed to partnering with someone who has applied. Okay. And then how there's been the suggestion that we can kind of reuse our original proposal and just highlight any changes. I'm hoping that doesn't mean that we're discouraged from making changes. We may want to make some substantial changes this time. Is that acceptable? Okay.
Absolutely.
And we struggled last time with budgeting. We had to do a budget modification. We'll probably have to do another one. I want to do a better job of budgeting this time. And so I'm wondering, as far as any guidance we may need around creating our budget, should we just, currently, I'm planning to meet with Bob Lally and kind of talk to him about our last budget modification, our next one, and kind of try to brainstorm how we can not do the same thing this time around. Is there any other guidance you want to give us about budgeting? And in particular, I'm kind of wondering, can we or should we budget any differently now that we're applying to you instead of to the CHRC? Or do you really want to see us doing it the same way that the CHRC wants everyone else doing it? I think what I'm looking for is like, do we have wiggle room to budget differently that we didn't have before?
All right, I lost audio for a second, so I missed part of the end of that.
Oh, okay. I'm essentially wondering, do we need to budget just the same way that we would if we were turning our proposals into the CHRC directly? Or does the hub have some like discretion to give us some wiggle room if we want to budget in a way that is sort of a little bit different than they recommended, but works better with our business model or something like that? Is there wiggle room, or would you like to see our budgets clearly look like the ones that are going directly to the CHRC?
Do we want to take that one back?
Yeah, I think so.
Yeah, I don't want to misspeak on that,
Yeah.
Catherine. So
Okay.
Yeah.
So you can answer that later.
Yep.
Yeah. All right. And those are all my questions for right now. Thank you.
Kathy Hedge. See your hand up.
I think you're muted, Kathy.
Okay.
Mhm.
Kathy's saying she may need to adjust her audio. So I think the next hand up is Brianne.
Yes, hi. How are you all? Thanks for having the meeting today. We really appreciate it. We are a new school-based provider in Queen Anne's County, and I'm just curious with, we're not new to CHRC though, we are in 5 jurisdictions, but as a new expansion into Queen Anne's, I'm just curious if you all want to share some of the need assessment information that you guys are looking for this RFP. That's one question. I'll start there.
It was suggested in the RFP to utilize the local LMBs, most recent needs assessments, and the youth risk survey, youth risk behavior survey, and the Maryland report card. I would start with those. We are in the process of, we just put out an RFP for a complete needs assessment for the 5-county area. So that is something that will be coming, but for the application process for this, you'll utilize those through the LMB and then the Maryland websites.
Okay. And then yesterday in the meeting, they shared, or maybe it was in another meeting, they were talking about the 15% overhead costs for when applying directly to you all as the hubs, and that there's some discretionary use there. So what are you looking for your spokes to use as their percentage when they're applying?
We might have to take that to our finance. I mean, it's in the RFP to use 15% for indirect costs, but I'm not sure if we need to take that.
So what they said yesterday is that the hubs have the ability to use some of that 15% for their own overhead costs. So it's not necessarily just for the spokes to be able to go straight to the 15%. So maybe we apply, first from 10 to 12.5, and that you all use the other 3.5 to cover your overhead.
I think there was also a conversation yesterday. They're gonna actually be meeting with us more specifically around that. So there might be other. I just don't think we have the answer to that yet. So
Yeah, that was one of the topics that they said they were going to have to come back with a follow-up on. So until they follow up, we don't know what the guidance is on that.
Okay.
I can write that down as one of the things that we take back, and as soon as we get a response, we can let everyone know.
Sure. And my last question for right now is in the request for proposal that you all released on page 5. It says there's some like blue bulleted that says, it's talking about the duplication of tier supports and things like that and key services, but this document only goes to 11 pages. Do you know if there was pages missing from this by any chance, or was this reflecting another document that just might be?
It's linked to the CHRC's RFP. So it's linked back to their document or tables.
Okay, got it. I have that. All right, that's all I have for right now. Thank you.
I have a question. Hi, everyone. Thanks for having us. I'm with the Cook Center for Human Connection, so we'll be a new provider of services. I had a follow-up question. Thank you, Brianne, for bringing up about the assessments. In fact, Taylor, you had just forwarded that information to us, and I appreciate that. In the document, it says we can use qualitative and quantitative information. So the quantitative information, clearly, I know where we can go for that information from the various districts, but what kind of qualitative information are you looking for that would enhance the acceptance of our proposal? Are you looking for information from the directors of student supports, counselors, psychologists, relative to, things like chronic absenteeism that may not be documented in some of those quantitative reports?
Taylor, do you want to take that one?
I honestly am not sure if I have a response for that one. It is copied from the CHRC's application, so that's what they require. Um, so
I would think that it also would be reflective of what needs have been identified by the county or by pupils and whatnot could be part of the qualitative.
Thanks, Audra.
Thank you. Thanks, Audra.
Okay, I think Heidi is next.
Yeah, hi. I'm sorry if I missed this in the RFP, but I don't see it. I know that you were meeting with the superintendents, and I had asked about if there was interest in any expansion. When will we find out about that, if so that we can include it in our proposal if there's other counties that have interest in programs that are existing already?
I would suggest if you're interested in expanding to include that in your RFP. Their schedules are pretty tight, and meetings have been scheduled, but most of them are not going to happen in a timely manner for the service providers to know for sure. So I would say if you're interested in it, I would include it, and that's something that we can discuss with them to find, if it, well, when we go through and review, we would know if that's a service that is needed in the area and would be supported.
And budget wise, should we just maybe by counties give an estimate, or how would you like for us to include that?
By county, I think would be beneficial. That way, if by chance one of the counties does not need the service, then it would be easy to look at it and say, okay, well, this portion of it will not be needed.
Okay.
Sean.
Hey everyone, thank you so much. Hey Taylor. Hey, quick question. I see that on track one, since we would like to apply for it from New Day to Start, should we submit this to you guys? Let's go through your local hub. Can you explain more about that? Like, do we submit to you guys or we submit through MDH? Can you explain? I'm a little confused on that part.
So if you're applying to provide services in Dorchester, Kent, Queen Anne's, or Talbot counties, the application would go to us here at Midshore as the hub. And then your information would be included in our application that we send to the CHRC for the funding. So you would apply to us, and then and then you are a partner on our application after that.
Okay, that makes sense. So we don't. I just want to make sure, because we do not submit to MDH. Submit it directly to you guys.
For our 4 counties, correct.
That's correct.
Okay, and then the last question. I know you said there's no letter of intent needed. Do we need to submit a letter of intent? I also want to make sure on that.
No.
Okay, so just complete the application. And then submit it to you guys. I just want to make sure that process is very clear. Okay, cool. Thank you so much.
You're welcome. Thank you. Kathy.
Can you hear me now?
Yes.
Okay, thank you. Sorry about that. And thank you for organizing this session for us. A couple of quick things. First of all, you may have answered this, but I just want to be sure. For the background and justification section, where we're citing different statistics from the community health needs assessments, if we are a prior applicant and we already completed that form, do you want us to do a new section with most recent data, or is there new data since we would have cited data from like this past January?
I don't believe there's new data at this time. For anyone that is a current spoke past applicant, you're just suggested to, from the CHRC, they have suggested to update sections such as your any new hires, budget, and programming, and highlight those changes with an added section of
how did they word it? Your current lessons learned from the current budget or from the current grant period. So no, I don't know. You wouldn't need to update that needs assessment area.
Okay, great. And then again, back to the updating the program. If we have developed some additional services or if we tweak the services, that's okay. We can just describe that in the proposal.
Yes.
All right. And then I actually didn't realize, but Heidi just asked the question about expanding to some of the other counties. If we're only in one or two of the counties that you're overseeing, and we'd be interested in expanding to another, we don't have to create a new application for each county. We would just do a separate budget for each additional county. Is that correct? Or do you want a full separate application?
There would need to be an additional portion in the application that stated what services you were going to provide in that county, and then a budget for that county. So if you're going to
Okay.
provide different services in each county, list, Talbot County, ABC, and Dorchester County, XYZ, and then the respective budgets.
Okay, got it. Okay, great. Thank you.
Let's see. Mr. DeWitt, I'm sorry, I don't remember your first name.
That's all right. I'm
My
Derek.
apologies. Derek.
Yeah, just an add-on. It was already questioned about letter of intent. How about letters of support from LEAs? Those will not be required.
Those are not required because they will be part of the decision-making process. So they are not required this time.
Okay, and for either returning providers or for new providers, correct?
Correct. If you have them and you would like to submit them as an optional appendice, you may, but they are not required.
Okay. Excellent. Thank you.
You're welcome. Jane.
Hi. Regarding the response to Heidi's question, that for an existing service provider, it would be possible to apply to expand into other jurisdictions. For a new service provider, could one application also propose services in more than one of the 4 counties?
Yes, yeah, I would be okay with that as long as it is listed again, what you're proposing for each county with a budget.
Thank you.
I have someone that's in the call. I believe they are on the phone, so they emailed me their question. Asking in the RFP, it references that letters from principals and verification from schools is for space is required, and is that something that they need to include in their application? And that's something that those individuals will be included in the review process, so you are not required to do that, because that would be part of the letter of approval from the superintendents and such. So you will not be required to have that. That's something that would come during the review process. Mindy.
Hi, everyone. Thank you. On page 8, where it talks about the budget and budget justification and outlines a range of $300,000 to $500,000 for hub activities and balance for services, can you define the difference between activities and services?
The 300 to 500, that's for your overall, that's the average of overall of what the service providers were asking for as their as their budget.
So
It's
that
not
was the
defined
range that was.
differently. It's not
Okay.
defined differently in the RFP. I'm not sure if anyone else on my team has more experience with that.
So that was the range that of projects that were funded in the past year.
That was the average.
That was the average. Okay.
Mm-hmm.
And can you speak at all to the likelihood of continued funding? I mean, I know it's a 1 year, 1 fiscal year. We just don't know.
That's not something I can answer. The consortium would be where that response would come from.
Okay.
That depends on their state of Maryland budget. I know that they are very passionate about this, so I don't expect it to go away, but we don't know for sure.
Okay. Thank you.
Kellyanne?
Yes, is there any way that Midshore could compile some type of list of the different agencies that are applying and what tiers people are interested in? Like, as far as I can speak for Queen Anne's, like for us to know what other people's interests are so we can make sure there's not, 4 grantees coming out with all tier 3. I don't know what that would look like, but I think it'd be extremely helpful if people, even if it's just like an interest kind of form, and then like the data could get pushed back by county of like what people are doing. I don't know. Any thoughts on that?
I can definitely look into it.
We won't know until they're received. I mean, we know who's existing.
I mean, I mean, that's something we could compile and share, but
Who are the current
of
folks?
I was just thinking in like a interest kind of like Google form. I just hate to see our county have no tier 1 when if no one's like, nope, absolutely not doing tier 1, if then people could potentially write into that. I don't know if other folks think that would be helpful, but I think it's hard when we don't even know who's applying or any type of interest for our counties to be able to expand services if we don't know if anybody has any interest in other services for Queen Anne's. So I don't know. I think it would help serve everybody in our county if we had interest from what other folks may be applying for, if that makes sense.
It does. I'll have to think about that one. I know we wouldn't share, who was applying for what. It might be something where it was like, okay, there's 5 interested in tier 3, 2 interested in tier 1, but I don't know how accurate it would be. Just because I don't know everyone that is planning to apply. There might not be on this call. There might be other people that were forwarded an email from a listserv, so I don't know how accurate it would be, or if we could even do that. I'd have to ask to make sure that's something that could be shared.
That's fine. And if not, it's totally fine. And I don't expect any names. Or even like, I don't know. I'm just thinking doing it being a second year. I think looking back for the people, at least for our agency, how we feel is we could have worked more as a team in our county. We're small counties, and we could have potentially worked a little bit better on coordinating these services. But like we didn't know, like I hear what you're saying, Taylor, we didn't know until the end who was awarded these grants. So I get that's kind of hard, but I think if Midshore is our main hub and moving forward, that I think that's an extremely helpful part if all the agencies that are involved in this can work together in an application to know what is being provided and not.
I'll definitely look into it, and if it's something that we can compile and get together, then it will be shared with everyone.
And I'm wondering if the school-based, like the mental health school-based person in each school, they might have an idea, because I know a lot of I don't know a lot, but I've heard that some folks have reached out to that mental health therapist in the school and asked if if they thought it was a needed program. Because we're not the official hub, like we're a pilot, we don't have the access to all that information. And that's probably, if we were the actual hub, I think we would have more information. We would have coordinated those services. But as the pilot, it just makes it a little difficult.
Yeah, technically July 1 is when the full hub goes into effect. So they're gearing us up to get there. So I'll definitely look into it and see what we can do about that. Because I do agree. It would be nice to know so there's not 20 tier 1 applicants for one county. That it makes total sense. So we'll see what we can do with that. Mindy.
I'm so sorry. I forgot to take my hand down.
Okay, no problem. Catherine?
Hi, thank you for taking more questions from me. So if you receive a proposal and you like parts of it, but not other parts, perhaps, one county and not the other county, or, whatever. Will you consider, or will you be allowed to, accept part of a proposal, to come back to us and say, we'd like to accept this part, but not that part? Or like the consortium did last time, they just asked us to shave a little of the budget off. Will you have that kind of discretion to offer us those options?
Yeah, after we have the review, when we're reviewing applications, we'll be able, if there's a section that maybe the school determines is not necessary, but another part of your application is, then yes, we would be able to have those discussions.
And then
and
you
suggestions.
Is it like you'd want us to make those changes in time for you to submit that on February 4th? Like we would need a rapid turnaround of making that change?
Ideally, we're still looking into what it's going to look like for having, what information I have to have from each of the service providers in our application. So that's, I would assume, obviously, we would know after having a conversation with you, but the application is for us, like the CHRC is not going to see your application. So I think we would have the discussion around that after the review.
All right. How do we access, you mentioned the LMB's needs assessment, and I'm not sure I don't recall having access to that last time. Not any formal needs assessment. How do we obtain that?
They're all posted on the LMB's websites. They have their most recent needs assessments and surveys posted.
Okay. And if we add another county to our application that we didn't have last time, you said we don't need to update our needs assessment if we're reapplying, but if we're adding a new county, is that answer still the same? Because obviously the other county might have different needs than the first county.
If you're adding a new jurisdiction, I would suggest adding in a form as justification as to why you think your services would benefit that county.
Okay, so some mention of the needs then, obviously, right?
For a new district, yes.
Mm-hmm. Okay. Do you aspire this time around? I think the answer is no, but I just want to check. Do you aspire this time around, perhaps, to propose for the hub to propose that you will collect data, that you will put into place some kind of data collection program that might ease our data collection efforts? Or should we absolutely propose to be completely independent in collecting our data and analyzing it as we did before?
From what was shared on yesterday's meeting, it sounds like the Excel formats that you guys are currently using is what I will have to provide to the CHRC in the next grant year. We do not know what that looks like yet. That's actually our next deliverable is a grant sharing piece or a data sharing piece. So that's something we will be working on in the next couple of months to know what it looks like. However, how we get the data from the service providers, I'm not sure how that will look like yet. I just know that I will have to provide the CHRC with those data templates that are currently being used.
Okay. As far as collecting data from families, we are surely still on our own to accomplish that, right?
At this time, I believe so.
Okay.
I'm sorry, Catherine, do you mean like gathering information from the families that you're working with? Is that what you're referring to?
Yes, I guess I envision hopefully maybe in the future someday, there will be sort of a centralized, like we can just send a link to the family and they'll, log on to some centralized.
Oh, I see what you mean. Okay.
We'll get all the data and we'll have access to it too. And, but that
Kind
would
of
probably
like the family, like a family feedback or like that kind of data, like
the
okay.
outcomes measurement essentially.
Yeah.
Data, or satisfaction surveys, which they also want.
Right.
Okay.
Well, something maybe we could work towards.
We can look into, yeah.
Yeah. Okay.
If I can, two more questions. This time the consortium wants us not just to submit our budget's going to have a new portion, which is going to show the overall cost of the project, right? I don't know how many questions you really want to answer about budgeting, or if we really should just be listening to the CHRC about those questions. But I wonder if you want to define direct versus indirect for us at all. I wonder if you want to talk to us about how we should use that overall project cost spreadsheet, or are you as sort of new to all that as we are, and are you not ready to answer questions about it?
Mitch has handled grants in the past, but I have not for this organization. So I cannot answer that. I don't know if anyone else on my team can, or if that's something that should be handled by CHRC. Anyone?
I think that whole indirect conversation needs to happen with us and CHRC first, and then we can
Put
would
it
have
in
more
our-
information.
We'll
We
post
would
it.
have more information, yeah, but we
Yeah,
have to
I
have
would
that
agree.
conversation with them first.
Yes.
All right, and exactly how, okay, and then I guess what I'm trying to ask, but I am not sure people have, if we should be asking you or CHRC, but so last time around we had to offset the salary, for example, offset the salary of our new clinician with the revenue she was bringing in. We thought originally we would offset it one way. We were told later that sort of differently from what we proposed, we would have to offset it a different way. There's a little bit of confusion. Is the overall cost of the project, that new part of the budget they want us, that new spreadsheet they want us to provide that shows overall cost of the project and then the grant funded part of the budget, is that intended to show, to accomplish that task of offsetting what we're requesting with other revenues? Or I guess I'm trying to understand how that is meant to work so that I fill it out correctly. And if you're not sure, I can take this question back to the CHRC as well.
That's what I'm thinking, because we weren't involved in that at all. So I don't know that we can answer that unless Taylor, something
No,
more.
they haven't had budget talks, and Bob wasn't on yesterday's call. So I don't have that information because that's part of their budget narrative template. Unless that have they asked current folks to do that as a separate deliverable currently, or are you just referring to what they've listed in their RFP?
What they've listed in their RFP, which I assumed we had to mirror in our proposal to you.
Okay. We can reach out to them and have a conversation about all the budget questions that we've taken down and then provide responses on that.
Great. Okay, thank you.
You're welcome. And just as a quick there's about 12-ish minutes left. So, Sean.
Hey, real quick, it's a real quick question. What's the deadline to submit it to you guys? That's one, because I know it's the 4th, to submit the overall thing. Do you guys have an earlier deadline?
January 17th, close of
Gotcha.
business.
Thank you so much.
Thank you. Abby?
Hi, yes, just piggybacking on Catherine's, my question was going to be on the Schedule 1 and Schedule 2 thing as well. So when should we, and I know this is not up to you guys, it's when they get the answer to you, but with Christmas happening and the holiday breaks, when should we expect an answer? Like, how do we proceed if we don't know what the budget template's actually going to be? Like, any guidance on how we, because it looks a lot different this year from last year, those of us that are current spokes. So yeah, just kind of guidance on how do we move forward if it's going to change.
I have been in communication with Lorianne already today, so I know that she is working. So as soon as we get off the call, I can compile a list and send it to Lorianne, Mark, and Bob, and hopefully get some guidance from them within the next day or two.
Okay, great.
Taylor, I have a question to that. Didn't you say that the budget's pretty much the same as what they've posted? It's just that it's 1 year instead of 3?
There is they have a Schedule 1 and a Schedule 2 budget template.
Oh, okay.
Listed in the budget narrative. So we've got and yeah, one of them is an overall project cost. So I'm not sure if that's required to be submitted to us or if that's something that is for individuals that are applying straight to CHRC.
Gotcha.
Taylor, would that overall cost be like what it takes to run our like whole agency, or like can you just speak on what they mean by that? Like I don't really get it.
From reading it real quick, it looks like it is the overall cost of your project. If CHRC is funding a portion of your in-school services, but not all of them, then what's the overall cost of your in-school services? So pretty much like what amount of CHRC is covering the budget that provides your services to student. That's the way I interpret it, but we will get clarification on it.
Yeah, and that's hard because we don't necessarily have those of us that are fee for service or billing.
Yeah.
We don't know, like it varies. So I think that's where probably Catherine and I are thinking it likely when we look at that question of how we actually come up with that.
I wonder if it has something to do with pulling out the portion of Medicaid money. Like what would it cost to have this employee? That's the overall. And then what portion of that is the grant actually covering? Because we're supposed to also be billing Medicaid. And I know this time around in our reporting, we had to kind of give an idea of what the portion of Medicaid was. And maybe that's what it is. Overall is, if we didn't have Medicaid, what would it cost? But if we can bill insurance, what is the portion that's being covered that insurance isn't covering? Maybe that's what that means.
Yeah. Again, I'll reach out to them for clarification. I would suggest, since we only have 8 or so minutes, if you have any more budget questions, to put them in the chat, and I will include them in what I send off to CHRC for clarification. Because I don't know if we'd be able to answer those bigger overarching budget questions at this time. Angela.
Hi, I just wanted to follow up. I know we had an email conversation about the letters of support. Just wanted to follow up. So again, we're just to submit our RFP to you, and then you guys will then take that RFP, submit it to Dorchester County Board of Ed, and obtain that letter. There's nothing that I need to do with the Board of Ed.
There are no letters for you or for us.
Okay, just wanted to check. In the RFP that you guys sent out, it did say that we could add additional letters of support from the school principals. And that's something that I could take care of if I chose to, right?
Yep, those are optional appendices. So if you choose to do that, then we would love to see them, but they're not required.
Got it. Okay. Just wanted to double check. Thank you.
Yep. Hey, Brianne.
Back on the appendices. For the mandatory appendices, I heard you say for the current spokes, they don't need to have the resumes and all of those good things. If you're not a current spoke, you need to have resumes in there.
No, I think we took that section out for
You
both
did.
sections.
Okay,
So
you
as
did.
long as you have listed, licensed clinician and information like that in with the organizational, that section, we don't need the resumes.
Perfect. Thank
Yeah,
you.
we would, if you're chosen and like later down the road, we would require a copy of your license, but not for this portion of it. Like when we do our site view reviews and that kind of stuff, we need license.
Am I missing? Am I missing anyone? So we got a couple minutes left.
Well, I put one in the chat, but I'll just ask. So can you clarify what you said about you wouldn't be able to answer further questions? I assume that's so that you're not providing some information to some applicants and not others. So can you just sort of clarify the boundaries on what communication? I have not been in this situation before, so what sort of communication we can and can't have with you? Is it kind of none and we'll have no further meetings? Is that until after awards are made, or?
It's a good question. Well, I'm just wondering with the budget questions and some of the areas that we're still trying to get firmed up on, just kind of offering this, Taylor, as a food for thought. Historically, we don't normally host two of these in a open RFP climate. However, there's some nuance, obviously, to this situation. So I think we may take it back and consider hosting another call after the new year. Just to provide some updates and kind of last minute questions. I think that might be really fair to do. That's just me, as I'm hearing all the things that we still need to follow up on, because we'll know more hopefully by then.
Yeah, I would agree with that because there are some things from the meeting yesterday with CHRC where they also had to follow up with more information. So there's still certain key aspects that we're waiting on information for. So I think it would be beneficial to have something after the new year once we get a detailed response from everyone. But I also I do still plan on putting together like question and answer lists from things that we said we would bring back to you guys.
Yeah, for just kind of based off the feedback in the chat and so forth, I think having another call will be on the horizon, so stay tuned.
Any other questions? Well, the recording for this will be posted on our website. If you go to our website, on the top bar, it says for service providers. In there, if you click on for service provider, it lists the RFP for this, and the recording will be posted there. And that is also where the responses from the questions from today will also be posted there as well. And then I will for those of you that are in school setting, they go back right after, like in the beginning of January, like the 6th or so is safe to say people are back in school, right? Because I don't want to get in the way of vacations and such for everyone. So I will, we'll look at planning another meeting for the probably that first full week of January. And same as this one, it would be recorded as well and posted on the website if you couldn't attend, but you will all get an email. I think I have everyone's email that is on here. If you did not get communication from me, if you want to put your email in the chat real quick to make sure you're added to the list, I think I have everyone that's on here. There might be one or two, just to make sure that you get that follow-up meeting. Were there any other questions?
If you're still taking questions, I have one more.
Sure, real quick.
As I read through the RFP describing, the use of the EPBs, of course, we have the list from the CHSRC, from their RFP, but I'm still a little bit confused about, I guess, how others are incorporating those, or we're looking at working with Good Behavior Games. We worked with them in the past. Do we write them in as a partner on our proposal and offer, their trainings in tandem with things that we're doing, or do we need to, train our own staff and then our own staff use those principles? What's worked in the past? And I guess I'm just trying to understand.
It can be done either way. You can either partner with them or you can do training with them. If they are not one of the priority EPBs, you can still write them into your grant. Any training you would have to write into your budget as well, because it's not like their training wouldn't be provided by the School of Mental Health since it's not one of the prioritized ones. But as long as there's justification, you can provide any EPB that's not on that list that they provided.
So the priority EPBs are that list of 15?
Yes.
Correct? And then
yes.
Other EPBs, that includes Good Behavior Games. So
yes.
If we do one that's not one of the priorities, do we not receive points on our?
No, you would still receive points for them. You would just have to justify why you're choosing that one, just because those are the ones that the School of Mental Health focus on. But you can use any EVS-based practice. Just any training for it, you would have to write into your budget because they would not be covered by the School of Mental Health. You would have to write in funding for training on those non-priority EPBs.
Taylor?
Gotcha. Okay, so for the 15, they would cover the training for that if it's one of those priority EPBs. But we can include EPBs and still get the favorable rating on a rubric. The funding just won't cover training for those. Is that correct?
Your funding that you request would cover it. It would just not be provided at no cost from the School of Mental Health. Okay. You would just find training for it outside of the School of Mental Health. You would find training from a different entity and write the cost of that training into your budget.
Okay, that is helpful. Thank you.
Yep.
I thought we were told that if it wasn't one of the priority EVPs, we would not get the extra points. I mean, we would not get the 15, whatever the points were. Did that change this time, or is it changing with Midshore, or was I wrong last time? Is anyone else?
It was discussed yesterday in the meeting that was held that if you can incorporate any that are any EPBs, they just have to have you'll have to include measurement data for them since they aren't tracked through School of Mental Health, and you would have to do the training for them in your budget, but you're still allowed to apply for them. There was nothing, I did not catch anything, but I would maybe re-listen to yesterday's meeting when they sent out the recording because there was a large conversation on it, but you are welcome to use any that aren't listed in the 15.
And Kathy,
There
you're right.
was-
That was in the last one. There was like extra points
Yeah.
if you used one of their recommended EPBs.
And they did mention that yesterday in the call. So I think we would have to go back to see, did we use the same rubric scoring for, if we're using their rubric or their scoring, then that would be the case. We would need to look at that.
And ultimately on track 1, it's Midshore that decides, right? Like, is that correct? Or maybe I'm not asking the right question.
There would still be a conversation with the school district to ensure that it's something that would benefit their district, that it was a need that was being met.
Okay. Most of our services are tier 1, and it felt like the priority EPBs were maybe those that would be used in a more clinical setting or, tier 3 type things. And so we've just been trying to figure out how to incorporate the priority EPBs or if we should focus on others. That's kind of where we're coming from.
We can re-listen and follow up with a consortium on that as well, but they did state that any EPB can be used as long as there was justification as why that was being utilized in the district. So we will follow up on that as well.
Looking at this, the RFP that's on our website, there is 5 points for priority EBPs.
Which one?
There's an
That's not-
additional 5 points if it's a priority EPB.
Correct.
Gotcha. Okay. So if it's one of the other EPBs, you don't get the 5 points.
Correct.
Okay.
Yeah, you would end up getting like the 20 points instead of 25 points is what it looks like.
Okay.
Out of 100, so.
Gotcha. Thank you.
Okay. Well, thank you all for attending. We will go ahead and post this up on the website as soon as we can. And I will send an email out for an additional date in the first week of January. So thank you all for coming and
Happy
showing your
holidays.
interest. Yes, happy holidays.
everybody.
Thank you. Midshore, can we stay on?
Yeah.
We just need to stop the recording.